Hello, my name is Stephanie Moss, also known by Med Psych Moss, and today I'll be answering some questions I received regarding ACEs, also known as adverse childhood experiences, trauma, and also my experience becoming a medical student. So first question for today is, what has made Stephanie Moss the person we know today? So I'm going to start off that I grew up in Boulder, Colorado, in I thought a pretty typical life environment, a mother, a father, and a younger sibling. And I grew up in an interesting city, which really did not have a lot of colored individuals. So I was one of the few Mexican Americans in my town. And I think that brought a interesting experience, especially the first time I actually learned that I had darker skin. And the first time I figured that out was in kindergarten when I was taken outside of my classroom, and they started asking me to read simple sentences and asking me pretty odd questions about my home environment, about learning English or Spanish, which one was my first language. And I started to realize that something about me was, they were treating me differently, and they didn't believe that I was going to be as successful as my peers because I came from a household that spoke both Spanish and English. And thankfully, after learning about that and able to pass all their simple questions, I went back into the other school and I didn't have to complete ESL, which is English as a second language. And at first I was very proud of that because I didn't want to be different. I didn't want to be segregated and unlike my peers. So that was kind of the first time I started noticing. And then as I started to grow older in elementary and middle school, I started to notice that my parents were different than the parents of my peers, and I didn't like that. I started preventing my family from my parents from being seen by my classmates. I didn't invite people home, and I just kept my head down and tried to show my teachers, my classmates, that I was as smart as anyone else. Flash forward a couple more years, and I went on to middle school, and this is where I really started to notice and meet other individuals with darker skin like myself who were also Mexican American. And I seemed to notice that there was a clear disparity and segregation of individuals who were Mexican American and individuals who were more Caucasian or had lighter skin than me. A lot of these classes and a lot of the differentiations were the advanced classes, the pre-IB classes or pre-AP classes once I got to high school were fairly populated by white or Caucasian individuals. And then when I went to my other classes that were more college prep classes, it was more populated by individuals that more looked like me or had darker skin. And so already I'm being very segregated of where do I fit in? I want to be smart. I want to be like the other kids. I wanted to be seen positively by my teachers and my peers. And so that's where I started to work really hard and put my head into studies and I'm the science and math girl, and really fight for my teachers and my peers to really see me as that. Then in the home environment, it was interesting because both my parents did not have a science or math background. My mother was a Spanish teacher. My father worked in finances with the state government. But thankfully, my father did encourage me, which I was very proud of, to pursue that path. And let's see, then I went to college. Specifically in high school, I remember that as we became junior seniors, college was everything the teachers talked about. I went to a school that was very privileged, and it was a public high school that was very privileged, but was in a zip code that a lot of the parents had quite a bit of income. So it was very expected that all those children would go to Ivy League schools or top tier schools. And I noticed very frequently that as They expected my peers to go to these Ivy League schools. Rarely was I ever encouraged to also pursue those high level tiers, even though I had a similar GPA as them. Most commonly they would be like, yeah, choose a state school or definitely go to college, but it wasn't as expected that I would be successful in my career. But anyway, I pursued, I went to college, I got into the state school, which I was at first embarrassed of because a lot of my high school peers did go to those Ivy League and very fancy, expensive schools. But I moved on. I went into University of Colorado in Boulder. I met my future husband. We were both in the pre-med track, and I was so thankful that I was able to have him to really encourage me and saw my potential. And he really encouraged me to fight for what I wanted and what I believed. And I was so thankful for that. It was really in college level track that once I started studying psychology that I started to kind of reflect back and to learn about different home environments that were not as conductive to successful individuals as others. And I didn't learn about ACEs until later, but I started to get kind of an idea that there were these households where there was physical or emotional abuse that would later turn kids to have mental health issues and struggle quite a bit in their academics. And I started to a little bit correlate in high school that I struggled, but at this point I didn't fully identify as being an individual who suffered abuse in my household. I knew that there was something difficult in my background, but a lot I attributed to myself, to my own hard work, and I continued on. Okay, many years later, and I had the huge blessing of an honor of getting into medical school. It was now in my first year of medical school where I struggled tremendously. I had huge imposter syndrome because, again, a lot of the individuals around me were lighter skinned than me, had a socioeconomic status that was 2, 3, 4, 5 times the income of my household. Kids who had gone to those Ivy League schools, but I was here in the same place as them. We both got into the same med school, so it was definitely humbling, but I still had a lot of imposter syndrome. It was, I believe, during the end of my first year of medical school that I learned about ACEs, which is adverse childhood experiences. And I remember reading in my house over and over the different qualifications of what real physical abuses, what emotional abuses, what psychological abuses and neglect. And I started to realize that I had experienced that I grew up in a household where I wasn't allowed to have emotions. I wasn't allowed to have feelings. I was always told that I was a bad person, that I wasn't worth it, that I was stupid, that I was ugly. And it was very painful to step into that knowledge that I had experienced that. And then why is this ACEs important? Well, because about in the late 1990s, a study was conducted by Kaiser where they actually looked at these adverse childhood experiences. So they asked thousands upon thousands of individuals to do a survey of if they had experienced some of these events. And then I mentioned the abuse, there's neglect, and then the other ones I didn't mention that I also struggled with is household factors. So having a family member who is themselves abused. So having a parent or a grandparent or some sort of abuse that's not happening on the child, but is in their household. Another one is having someone in their household with a substance use disorder, having a family member who has been incarcerated, so gone to jail. Another one is having some sort of mental illness. And the last one, mental illness kind of goes with also and or committing suicide or trying to commit suicide. And unfortunately, there were multiple key points in my life that I have flashbacks and remember where my parent used suicide as a way to kind of get our attention, to try to make them feel that they were the only ones that we needed to care about them instead of our own feelings. Let's see. Oh, and divorce. So if going back to that Kaiser study, if anyone experienced any of those events in their childhood, so before 18, that is 1 point. So 1 point for one event. And people would, check mark. And then it went back to the researchers. Then they looked back at their health care history and saw which individuals had health conditions, more chronic ones like heart conditions, diabetes, pulmonary, so lung cancer, lung conditions, anxiety, depression, things like that. And what they found is they found a significant correlation of individuals who had multiple adverse childhood experiences later in their life develop these mental and physical health conditions that would decrease the years that they would be alive and significantly impact their social life, impact whether they finish high school, whether they how far they can get in the social status, whether they themselves will be successful in their own marriages or families or relationships. So many conditions. And this is pretty significant in the medical career because it really started to bring awareness to the concept how trauma, so something significant in someone's life, can really have a long-term impact on someone's life, both physically, mentally, and also in their day-to-day life. What was so impactful is as I started to look at these ACEs and connect to the different points where I started to also recognize that I myself had separately also mental conditions. So it was, I believe, kind of between my first year and second year of medical school that I had been seeing a mental health therapist by my school. And I brought up the concept of, do you think I have anxiety? And my therapist was like, well, what do you think? And I started naming all the things that I learned. And he's like, yeah, that sounds about right. And I was diagnosed with generalized anxiety disorder. That means that I'm not just anxious about one small thing. I'm anxious about everything in life, anxious about my relationship, friendships, social. I stress about I have huge anxiety about my school, about perfectionism. Everything in my life is stressful all the time, 24/7. And that's where at this point I had been having therapy for over a year, and I brought up the concept of, what about, should I start meds? Like, I was scared, but I am so glad I did, because it really changed my life in being able to see problems as not attributed to myself, but as separate than me, that I can now address problem by problem. So that is a little bit of my quick condition of how I grew up dealing with adverse childhood experiences, recognized that I had them, and then was able to kind of rectify with myself and accept, yes, I had gone through these traumas and this is what I can do. This is the results, is my health conditions, but I can do something about it. It's not because of me. I'm not the problem. Yes, I have problems, but doesn't mean that I can't continuously heal and continuously be better for myself and for my future patients. Next one. What encouragement or words of advice do you have for girls and boys who feel unheard and consequently unseen? It's especially hard to go against authority, whether that be a parent or an educated professional. I totally agree, and I hear you. It is so hard to go against people of figure. We're taught from, many of us are taught from a young age that the parent is the all-knowing one, and we as children are unable to think for ourselves or have questions, and that is not fair. Yes, as a little kid, that might be true. Parents are there to guide and teach children so they don't get hurt. But as they grow older, a healthy parent in child environment actually encourages the children to make mistakes, to figure out what is important to them, and try to be their own person, try to advocate for themselves instead of the parent telling them what to do or talking to others. And so in regards to encouragement, I would say that you're not alone, and you have so much power, but maybe you just don't see it yet. And even though it doesn't feel that you have any power, know that you do, that you deserve to be heard. Your voice deserves to be heard. Your pain deserves to be heard by someone. And if you go up to an authority figure, whether that's a parent, a doctor, a teacher, and you express your pain or your struggles and they ignore you, and that's not the right person. You're not the problem. They're the one who doesn't want to listen, and that's okay, because there are so many other individuals who will want to fight for you and believe you. So if 1, 2, 3 people come to you and say and discourage you, that's their problem. Not everyone's going to be like them. That was a hard problem for me to learn, because I remember so many guidance counselors told me, why am I doing IB? Why am I doing AP? Why am I doing pre-health? Why am I in med school? Even now, as a medical student failing a board exam, I've been told by other physician mentors that, medicine's not for everyone. Yeah, that hurts. That hurts a lot. But I know that there are other physicians and mentors who do believe in me. And so I'm going to pay more attention to people who believe in me, and I'm going to pay more attention to myself, because I know that I can do it. Next question. The data about ACE factors and their negative correlation with income and their association with heart disease, lung cancer, and homelessness are all known. 5 of the 10 leading deaths in the United States are associated with ACE factors. With all that is being known, why has the response to ACE factors been so minimal? I agree with that. It is very sad of how little has been done, but there are people working on it. It is slowly developing movement called trauma-informed care. It's something that I'm very passionate about, of teaching my fellow peers, my physician mentors. A lot of the big academies of pediatrics, the CDC, have mentioned these factors. There's so much research out there, but I think why there has been such a minimal response is because a lot of trauma is negatively stigmatized, which makes sense. We don't want to talk about things that hurt us, things that happened long ago, and also how prevalent it is. We don't like to talk about painful things. And so even physicians, it's difficult for us to bring up the conversation, because we might also be uncomfortable with our own personal trauma. So I think it's so important for us to start the conversation as physicians and as providers, to actually start talking about our own traumas, get to know our own traumas, heal from our own traumas, so we have the confidence to then talk and heal with other people regarding their own traumas. I think that psychiatrists and the psychological and field have been working a lot on trauma for quite a bit of time, 20, 30 years. There's been a lot, or actually more than that, maybe 40, 50 years. There's been a lot of work talking about it, but we still need to have something called interprofessional collaboration where the therapist, psychologist, primary care physician communicate and talk about it, talk about what the patient is going through and do a holistic patient-centered approach, because it's not just one physician or one provider that's going to solve the patient's problem. It really takes so many providers times, because there's limited time to see patients, limited time that a patient can have off, because most of them have to work. Everyone usually has to work. It's hard to get time off. So it really requires a holistic approach from all different avenues to really attack this issue. And that even correlates outside of health. We're talking about adding in teachers, counselors, to social workers in the government. It really needs to be a whole collaboration of individuals. I know that when I was working as a case manager and working closely with the city department, with individuals who had disabilities or in the foster care system, they are trying, and I think that is a good start. But we need to collaborate, tell each other what we know, because we know a lot, but they're in these little pockets. We need to bring that information together and advocate for other individuals. As a soon-to-be resident, what do you believe what do you believe is the responsibility of the physician to screen or mitigate and even prevent ACEs factors in holistic medicine? Is that more than what is currently required, and what does it look like? Great question. I think it's a huge responsibility of the medical community to consistently ask verbally, but then also written or in other forms of communication, if our patients have experienced some sort of trauma in our life. And I didn't talk about it before, but even though there are those 10 ACEs, those are not the only ones. Those were just the main common ones they saw 20 years ago. Since then, there has been phenomenal amount of research seeing all the different traumas, not just as a child, but throughout someone's life, that can have a serious impact on their mental, physical health, and also their socioeconomic status and the rest of their life. Some of these include racism, which is huge, different traumas regarding being abused with a partner, so a partner type abuse, psychological and mental. So, people who are in any type of war zone or have any natural disasters, fire, earthquakes, so much stuff happens, car crashes, maybe a huge medical or ER stay or a huge surgery. So many traumas happen every day in an individual's life. And I think it's so important that us as physicians talk to our patients regarding their history with not the lens of just medical, but more of trauma. What in their life recently or in the recent or past future has impacted who they are today, how they believe in themselves, how they understand their own health, and their motivations for improving their own health. So I think that is so important. And some clinics do have papers where individuals can check if they have the 10 ACEs, but I think we need so much more than that. I remember there was one of my mental health appointments that I went in college, one of my first therapy appointments. They had a thing that I could fill out that talked about the ACEs, but also talked about all the other types of trauma. The initial interview was really talking about, okay, well, which of all these things was most impactful for you? How do they impact your life, or how does it change how you see who you are? So many things are interconnected. And I think it's also important to not just ask once, it should be continuously, because trauma, like I said, doesn't just happen 10, 20, 30 years ago. It can happen any single day, and it can impact you physically and emotionally. So it's important for us as physicians and healthcare professionals to constantly be asking the questions regarding trauma and stress in an individual's life. Last question. What resources would you like to share that can help with awareness, screening, and the presentation of ACE factors? I think one of the most important or one of the most comprehensive places is the CDC, that they have a lot of things out there that make it easy both for practitioners, for individuals with no knowledge of healthcare, for teachers. They've done a great job, and that is a good starting point. I've worked on creating a website, medpsychmos.com, that shares all those different websites so people can go and connect, because there's just so much out there, so many books, so many videos. And my goal is really, it started out with like myself, I wanted to kind of organize all these different resources and put them in one area to link to. And so that's what I've been trying to do on my website, and I will continue to do. Keep adding resources to my website that you can link, that if you struggle with mental health, you can go this way. Or if you start struggling with similar conditions that I do, like infertility or pelvic pain or endometriosis, you can also go into that section and see tons of resources for that section, but really focused on a trauma-informed lens. So not just focused on the medicine, but really the holistic, how to heal someone and work with people in all aspects, mental and physical. And yeah, if you have any other questions, I would love for you to send them to me. I'll be posting this on my YouTube channel, medpsychmos.com. I'll also be sharing it on my website, medpsychmos.com. Oh, wait. Yes, YouTube channel, MedPsychMos. And that's also where whenever I see a mental health video or some video that connects with me or connects with a peer, I save it to a special playlist. So really I want it to be an area where it is a collaboration of not just for patients, but also for healthcare providers, where they can also get information about other people's experience, learn from it, so they can also take it into their health practice. So thank you so much for listening, and check me out at medpsych.com. I'm also on Instagram and Twitter at medpsychmos.com. Thank you so much. Bye-bye.